So let's talk about injectables just briefly. Botox, we know, is the workhorse of injectables. We use it forever. We use it typically in the upper face. It can get rid of crow's feet. It can get rid of these 11 lines in the center of the forehead, and then these horizontal lines in the center of the forehead. Of course, this patient has absolutely none of those. There is no downtime, which is great. It typically lasts about 3 months, and then you have to come in and get things re-injected. But you can see the worth it rating extremely high. Patients are very happy with Botox, and sometimes we'll even call this prejuvenation as opposed to rejuvenation, because it can really prevent the wrinkling that is seen later. And then filler. Um, the predominant thoughts these days on filler is that probably it's overused. I think probably both of my partners would agree with that. But for select reasons and indications, it can be very, very useful. So you can, use it to plump the cheeks here. You can use it to fill in those tiny lines that are above the lips. You can actually use it to fill in the lips. Some people use it to reshape the jawline, whether that's to add some to the angle of the mandible or to the chin. It really is quite versatile. Results vary based on where it's injected as well as what filler we're using. Downtime is not very frequent. Rarely you can get some bruising afterwards that can last a couple days. And overall, people do say that it's worth it. This varies based on where it's being injected. A lot of times the cheeks and the lips are some of the happiest patients. And then one thing that I wanted to just briefly touch on because we're very excited about it, and maybe you've heard. So just this month, the FDA approved the first neurotoxin that's been approved since Botox. And so this is expected to last 6 months versus 3 months. And when we say it lasts 6 months, what we mean is 50% of patients at 6 months will still have the desired effect that they injected for. And that's still twice as much as Botox. We're not sure how much this is going to cost yet, but we expect that it'll be a little bit more than Botox, and simply because it is lasting so much longer.